Good evening. Welcome to the main part of our meeting tonight. I'm the Vice Mayor Pinkston. I'm standing in tonight for Mayor Wade, who's out due to a death in the family. So the meeting will proceed as normal, but just so you know what's going on up here. We'll begin the meeting tonight with a moment of silence, please. Okay, thank you. Are there any announcements?
Yes.
Fantastic.
And I come bearing a prop. May is Bike Month in Charlottesville. Bike Month is a collaborative effort including the city and county staff, area nonprofits, local businesses, and volunteers to celebrate the joys and benefits of bike riding. This year, events will include group rides, e-bike test rides, and a bike valet at Fridays after 5. Save the dates for Bike Walk and Roll to School Day on May 8th and Bike to Work Week, which is May 13th through 17th. Check out the Bike Month website to learn more about fun events or to volunteer at bikemonthseville.org. Thanks.
Thank you very much. Next.
Two announcements. The first is that the deadline for the My Help List contest is April 19th. The My Help List contest is a contest in where students in K through 12 write in 150 words or less why it's important to help others because, and list 5 things they are done or can do to help someone. There will be 4 winners chosen from grades K through 2, 3 through 5, 6 through 8, and 9 through 12. Each will receive $100 cash prizes. All letters can be mailed or dropped off at Jones Heating and Air at 633 Rose Hill Drive. And again, the deadline is April 19th, this Friday. And the second is a proclamation for, sorry,
Okay.
I'll hold off.
We have another announcement over here from this side.
Yes, been asked to announce that the Charlottesville Youth Council is taking new applications, be new members for, I guess, for the next school year. It might start immediately, I'm not quite sure. The deadline to apply is May 3rd in any event. I guess it would have to be for next school year. You apply by May 3rd, and we would pick them on, I think, our May 20th meeting, and then you would be up for the next school year. This is a group of up to 14 members, Charlottesville residents 13 to 17 years old, who would represent Buford or CHS or Lugo McGinnis, and also there are some spots reserved for folks who are going to private schools and or who are homeschooled. To serve as advisors to the City Council by advocating for youth-related issues in our community, must be available to meet monthly, and the meetings at this point, let's see, it says third Wednesday at 6 p.m. during the school year. And if you want more information and if you want to apply, they gave me this fancy little poster here with a very hard to remember URL. The easiest thing to do if you're interested is just put Charlottesville Youth Council into your search engine and it'll pop right up. The first entry that will show up is there. So if you would like to be or have a kid who would like to be involved with the Charlottesville Youth Council, sign up. Thank you.
Thank you. We have 2 proclamations tonight. We'll let Councilor Payne go first, please.
Now I'm ready. This is a proclamation for National Public Safety Telecommunications Week and the 40th anniversary of the CUA Emergency Communications Center. Whereas in an emergency, community members depend on public safety telecommunicators and access to 911 as their primary means to request help from fire and rescue, law enforcement, animal control, and emergency mental health responders. And whereas when an emergency occurs, the prompt response of field responders is critical to the protection of life and preservation of property. And public safety telecommunicators are the first responders, the single vital link between field responders and persons seeking immediate relief during emergency. And whereas the Charlottesville UVA Albemarle County Emergency Communications Center was founded in 1984 as a partnership between the City of Charlottesville, the University of Virginia, and Albemarle County. And whereas public safety telecommunicators of the CUA ECC process approximately 100,000 calls per year from persons who call, text, or video call the Emergency Communication Center, and ensure the safety of field responder personnel by monitoring their activities and providing them crucial information, thereby significantly contributing to crime reduction, fire suppression, and patient treatment. And whereas each day, public safety telecommunicators provide life-saving treatment instructions, compassion, understanding, and professionalism during the performance of their jobs. Now therefore be it resolved that we, the Charlottesville City Council, acknowledge and commemorate the second week of April 2024 as National Public Safety Telecommunicators Week in honor of the telecommunicators and those whose role provides support for them, whose diligence and professionalism keep our communities safe and healthy.
Thank you. Yeah. Come on up.
Mr. Vice Mayor, if I may, I just wanted to say it's a privilege to serve. Thank you. It's a privilege to serve as your Executive Director of the Regional Emergency Communication Center. I'm also the immediate past president of Virginia's chapter of Association of Public Safety Communications Officials. On behalf of both organizations, I want to say thank you for recognizing the efforts of our 911 telecommunicators. I'm thankful for the over 60 coworkers that we had at the ECC, including our public safety comms officers and all that support them. You know, we often think about our 911 telecommunicators working behind the scenes or under the headset, as we say, but they truly are the first responders. They provide life-saving instructions over the phone and comfort others until help can arrive. So I'm thankful for the acknowledgement today. Joined with me to receive this proclamation are representatives from the ECC. So with your permission, Mr. Vice Mayor, I would ask for them to stand and be recognized.
Yes, please. Thank you very much.
So with that, thank you, Mr. Vice Mayor. I'd also mention that we're going to have a community open house this week on Thursday, April 18th from 4 to 7 p.m. And the community is welcome to join us for some hot dogs and hamburgers and whatnot.
Excellent.
So, thank
And
you.
where
Thank
will
you so
that be
much.
again?
So what's that?
Where will that be again?
That'll be at the ECC, located over on Ivy Street. So, yeah, thank you.
Thank you.
Yep. Thank you.
Great. And we have another proclamation from Natalie.
We do indeed.
Councilor Ostrom.
Thanks. We do indeed. I'll read this one. April 30th, 2024 is Adopt a Shelter Pet Day. Whereas more than 6 million pets end up homeless each year in the United States, and whereas in our community, the Charlottesville SPCA facilitated the adoption of over 2,650 pets in 2023, and whereas animal rescue employees, volunteers, and the community work tirelessly to help homeless pets, and whereas the Charlottesville Albemarle community helps support homeless pets through care, love, and donations of time, supplies, and funds, and whereas pets often make life better by giving people love, companionship, and comfort, getting us outside for exercise and helping us build social connections. And data shows that 84% of pet owners feel their pet improves their mental health. And whereas our community recognizes the benefits of pets and is collaborating to reach our lowest rate ever for pet homelessness. Now, therefore, the Charlottesville City Council recognizes April 30th, 2024 as Adopt a Shelter Pet Day and call upon our community to observe this day with support, compassion, and consideration to adopt a shelter pet if it is right for you, your family, and the pet. Thanks.
Thank you very much. Is there anyone from the SPCA here tonight? Okay, we'll make sure they get this in the mail. All right, well, thank y'all for that. So we're going to move now to the next section, which is Community Matters. So there are 5 pre-registered speakers, leaving 11 slots for additional speakers on Community Matters. If one of the first 8 speakers is absent, a person on the wait list will take their speaking slot. That's not an issue tonight. Each speaker will have up to 3 minutes to speak. We'll now open the floor to pre-registered speakers. Our first registered speaker is Ashley Cleaves. Are you able to come? Great. Come on up. Thank you. You have 3 minutes.
Okay. Good evening, City Council. My name is Ashley Cleaves, and I'm a passionate first-year sustainability student at the University of Virginia. I'm here to speak with you today about the recycling and accessibility in Charlottesville and why accessibility is so important for the community moving forward. I applaud the Council's commitments to economic equity, environmental justice, and a more accessible Charlottesville. However, me and my group members have proposed improvements to the current system. These improvements aim for more equitable waste collection practices for our residents. I urge you to promptly consider and implement our proposals to help achieve a goal of living in a green city. Approximately 56% of Albemarle County residents say they view the county's allocation and quality of recycling services as fair or poor. Meanwhile, 59% of residents say that recycling services are somewhat very inconvenient to access. Residents in apartment complexes are being increasingly neglected the right to equal access to waste management programs. In Charlottesville, 47.89% of people live in apartment complexes, and senior citizens comprise 12.5% of the Charlottesville population, many of whom live in apartments. While collecting data on the recycling issues in Charlottesville, I came upon Melissa Elliott, a recently retired woman who has experience with inadequate recycling practices in Charlottesville. She had sent 3 previous emails to the City Council, and the one response she received included barriers to change the current system, which were unaccepting to new change. Melissa highlighted how, in quote, "Some of us are too old, unable to do the lifting and carrying, some too busy," end quote. City Council replied that the recycling truck is too large for her neighborhood, and she now urges for a smaller truck. She additionally wishes that she could be on the same smart motivating system as other city dwellers, in which she pays for landfill trash but saves money by recycling. And her last wish is that her and other neighbors have a way to get their food waste to city compost, and that the compost machine be easier to use through accessibility metrics. It's very important for everyone in the community to be able to have equal access to recycling resources, so fostering greater accessibility to senior citizens is important, fostering greater equity in the entirety of Charlottesville. Our recommendations for promoting better recycling practices fall into 4 categories: reduced cost recycling for Charlottesville residents, requiring all apartment complexes and multi-unit homes to provide recycling services to residents, reallocation of tax services, and introducing a recycling incentive program. And by implementing each of our proposals, we will be able to contribute to Charlottesville's 2025 vision of a green city. And my group member, Dade, will explain our proposal in further detail. Thank you so much for your time.
Thank you. All right, our second speaker is Dade Carroll.
Am I good?
Go ahead.
All right. Hello, I'm Dade Carroll. I'm also a UVA student working with Ashley in another group. And I'm just going to talk about the 4 points we created. So the first point we wanted to talk about was reduced recycling costs. And according to the U.S. Census Bureau, nearly a quarter of Charlottesville residents live in poverty. And we believe a free or reduced cost recycling service will be able to mitigate the economic disparities and help increase recycling rates in Charlottesville. And I want to point out what Richmond does. And in Richmond, for the elderly, those with disabilities, and families that make less than $60,000 per year, they're exempt from waste and recycling fees. And in 2021, Richmond's recycling rate was actually at 58%, while the rest of Virginia's was at 43%. And so implementing a system similar to that, I feel would improve the recycling in Charlottesville. And onto our second point, for the apartment recycling services. As you know, many multi-unit apartment complexes aren't covered by the city waste collection. And then these complexes are then reliant upon private collectors. But as Ashley said, private collectors aren't always willing to provide recycling services to some apartment complexes like Melissa's. And then here we want to look towards Alexandria, where all apartment complexes and multifamily homes are required to have recycling services. And we see in 2016, Alexandria's recycling rate was actually at 49%, while the rest of Virginia's was at 44%. And then as Charlottesville grows, you're going to need those new recycling services for the new buildings, but also the current ones to reach green goals. The next point we have was for taxes. And so all Charlottesville residents pay taxes, but not all of them are receiving the same services like Melissa. So she's paying taxes but not receiving any recycling services. And in a 2020 Charlottesville survey, 74.8% of the participants actually scored tax allocations towards protection and management of land to support native plants and wildlife as important to very important. And that shows that Charlottesville residents do really care about the environment and sustainability. So we kind of urge the local government to allocate more resources towards the waste reduction and environmental protection through either that free reduced recycling services or having private companies provide the services, and if not, maybe the city could provide services to those apartment complexes. And then finally, we'll have like recycling incentive programs. And this is our least fleshed out idea, but like there's a lot of things we can do. When we talked to Melissa, she mentioned how she composts, but since they don't have like composting service, everyone in her apartment complex, they actually put their scraps in their fridge or freezer to like let it sit there. Then one person will collect it, then take it to the recycling or McIntyre or whatever. And then so possibly maybe if you turn in compost, you get like free compost back or free fertilizer back or something.
Thank you for your comments.
All right, thank you.
Yep. Next up is Carrie Lopez.
Hi.
Hi.
Good evening, everyone. My name is Katie Lopez Godoy, and I am a member of Impact. I live in Charlottesville, and I'm here to share a testimony on behalf of one of our community members that was not able to be here with us this evening. We wanted to share this testimony to emphasize how important the public buses are here in Charlottesville. We are glad to hear you plan to fund 8 more buses, 8 more bus drivers this year, but we know that at least 11 are needed to start turning things around, and likely more in the next few years. And here is our community member's testimony. She says, "Good evening. I want to give my testimony about the use of public transit buses in Charlottesville. I am a person who doesn't drive and has to use the bus 7 days a week, as my family members work and don't always have time to give me a ride. The problem is that since the pandemic, the bus service is very irregular. Some days there are not enough buses. For example, instead of 3 buses, each on Route 5 and 7, there might only be 1 or 2 buses. Because of this, passengers like me arrive later to work or whatever they're going. I have been greatly affected by the irregularity of the bus schedule. There have been times that I've arrived late to work because the bus didn't come on time. There have been times I've had to walk an hour or an hour and a half to get to work. During the winter, the situation is even worse because we have to wait a long time outside. I've had to sit at the bus stop with elderly people and women with young children while it's very cold outside. I'm also limited in when I can make doctor's appointments because there are always a chance the bus will arrive late or won't show up at all. I think, like me, there are many other people that are living in the same experience. There are other problems too, such as the bus not running late enough at night or on Sundays. No matter what plans are made, things will not improve until we have enough bus drivers. We need at least 11 new bus drivers in this new year's budget. Thank you.
Thank you. The next speaker is Alana Baker.
Thank you. Again, my name is Elena Baker. I'm a licensed clinical social worker here in the state of Virginia. I do work at University of Virginia. I work in the Department of Psychiatry and Neurobehavioral Sciences, as well as in our addiction research clinic, which is called CLEAR, the Center for Leading Edge Addiction Research. My team couldn't be here tonight, but I did want to give a shout out to my 2 social work students from VCU as they helped me create this presentation. So I'm here tonight to speak about comprehensive harm reduction. Harm reduction refers to any strategy that minimizes harm for our community members. Every day we engage in and see acts of harm reduction, such as when we make sure to put our seatbelts on, when we wear a bicycle helmet, or even when you or the local bartender calls a taxi for somebody who has had too much to drink. According to the CDC, harm reduction, when practiced as a larger community-driven initiative, effectively reduces the harmful consequences of substance use, not only for the people who use drugs, but for community as a whole. Strategies for harm reduction may come in the form of prevention through education, risk reduction through resource provision, and ultimately health promotion through low barrier access to services. Through these pathways, we take care of one another, creating and promoting safer communities in the future. And many of our community agencies and community members, such as On Our Own, Region 10, the Buck Squad, the HEART team of Albemarle County, the Anchor team here in Charlottesville Harm Reduction, and many more, are already doing really amazing things in our community for harm reduction. So harm reduction is not merely a good idea. It has been proven to work in practice. The first syringe exchange program in the U.S. was launched in 1988. Currently, there are now about 450 programs across the country, including about 10 here in the state of Virginia. They are operated by the Virginia Department of Health, or approved by the Virginia Department of Health. Not all of them are operated by the health departments. They include offering clean syringes, exchange and disposal for those, naloxone for reversing poisonings, fentanyl testing strips, safe sex equipment, hygiene kits, testing, and more. Comprehensive harm reduction is endorsed by the WHO, the CDC, the U.S. Department of Health and Human Services, and the Virginia Department of Health, as well as major institutions as a core public health strategy for addressing the HIV and opioid epidemics. I'm going to skip the other stuff. What UVA Clear is proposing is to start operating a CHR program here in Charlottesville, as well as a harm reduction vending machine. Oh God, I'm out of time. Sorry, I did want to say we are going to host a couple of town halls here in the future, and I will make sure that we get the dates out there, because we do want our community engaged.
Thank you so much. If you could get your information to Deputy City Manager
Yes.
Reynolds, Marshall Reynolds, please.
Thank you.
You get a chance. Thank you. Next speaker, Catherine Renner.
Good evening. My name is Kate Renner, and I'm a third-year electrical engineering student at UVA. I'd like to talk to you about the future of natural gas use in the city. Charlottesville is witnessing an expansion in its natural gas infrastructure, with the gas division offering new service connections up to 150 feet from the main at no cost to the residential customers. The city subsidizes these installations with more than 125 free gas line installations awarded annually, totaling around $250,000. Considering the environmental and economic benefits, reallocating these subsidies towards promoting heat pumps in new home construction could offer a more sustainable alternative despite their higher initial costs. Everyone knows that fossil fuels have disastrous effects on the environment, and roughly 1/10 of total U.S. emissions come from homes and businesses burning natural gas, oil, or propane on site to heat their space and their water. So by continuing to offer natural gas line subsidies, the city of Charlottesville is perpetuating the problem rather than presenting a solution. The city itself set a goal of 45% reduction in community-wide greenhouse gas emissions by 2030, and the way to accomplish this is not to promote gas line installations. According to the 2024 Charlottesville Decarbonization Study, the city needs to, and I quote, establish a new fee structure to disincentivize new gas connections, as well as fund the expansion of new utilities energy efficiency programs. Not only are heat pumps a greener alternative, but they eliminate risks associated with gas leaks and carbon monoxide poisoning, ensuring safer living conditions for residents. They do not produce combustion byproducts indoors, so the indoor air quality is safer and the risk of respiratory issues is reduced significantly. I understand that gas furnaces are cheaper to install than heat pumps. However, heat pumps are highly efficient and can cut electricity use by 50% when compared with electric resistance heating, according to the DOE. So moving away from fossil fuels reduces the homeowner's costs over the lifetime of the appliances when compared to gas furnaces. According to Energy Star, the U.S. government is also already offering up to $2,000 of tax credit for heat pump installations. So if the city of Charlottesville were to leapfrog off of that, the higher installation costs would be less economically disadvantageous to those who are less fortunate and for whom the gas line subsidies are for. So if the purpose of the subsidy is truly to serve the community, then the city is doing its residents a disservice by presenting natural gas lines as a solution rather than heat pumps. Thank you for listening to my suggestions and also for your dedicated service to the community.
Thank you very much. Okay, so that is the last of our pre-registered speakers. At this point, we'll open it up to folks who'd like to speak. If you'd like to speak, please raise your hand. In the back, yes, ma'am. And when you, either one, yes. Just please be sure to mention your name and where you live.
And for anybody who wants to speak on the tax rate, that will be a public hearing after this.
Thank you. Yeah, thank you.
Thank you so much for this opportunity. My name is Myrna McClernon, and I've been a longtime resident in Charlottesville. I have a short but powerful statement to deliver to the City Council in a respectful manner. Over the past decade, largely due to public policies, the population and density of our city and surroundings have escalated dramatically, creating untenable traffic and demands on our city's aging infrastructure. In addition, recent changes to Charlottesville's zoning ordinance are expected to further increase density levels and vehicular congestion, resulting in worsening the livability of Charlottesville. One of the bold actions the City Council must take now to alleviate or moderate these trends and sustain Charlottesville's livability is to make significant investments in our city's bus system, which is why we are definitely proposing 11 new bus drivers as opposed to 8. We do appreciate the 8, however. We implore you to step up, act responsibly for the health, welfare, and sustainability of the city you were elected to govern. Thank you so much for your time.
Thank you. You, sir? Please tell us your name and where you live.
My name is Downing Smith. I live at 810 Locust Avenue. And the lady's right, the bus system needs a lot of improvements. And to your recycling people, my recycling is fine. I get free stream, mixed stream recycling at my house. The cost for my garbage is like $100 a year. However, people living in large complexes, sounds like to me they aren't getting a good deal. I was going to talk about taxes. I don't want to hang around for the public hearing. But it did get me down here, so I'll talk about other taxes. My property taxes have gone up 50% in the last 5 years. They're going to go up 10% more this year, 60. So in 10 years, that means my real property taxes will have doubled. Y'all talk about sustainable housing, affordable housing. You aren't going to get any affordable housing if you keep driving up interest rates at these rates. The only people who are going to be able to afford homes are the very rich and developers. And so you need to start spending your time and efforts on what is the business of Charlottesville rather than doing things like contributing to private charities. I support giving our good city employees raises, but you don't have to raise our property taxes to do it. You should find things that really aren't the business of the city. Stop doing those things and spend the money on giving our employees raises, giving this lady her buses, and giving the people who live in apartments good access, inexpensive garbage and recycling.
Thank you, sir. Who else would like to speak? Raise your hand, please. Okay. With that, we'll close Community Matters. So that was our final speaker for Community Matters. There will be another opportunity for public comment at the end of the meeting. So the next item is the consent agenda. Ms. Thomas, could you please read the consent agenda?
Number 2, minutes, February 27th, alternative fuels work session. Number 3, a resolution appropriating funding for the Rugby Avenue Bicycle and Pedestrian Trail Project, $130,059.50, second reading. 4, resolution appropriating funding from the Bama Works grant to Community Attention Foster Families, $5,000, second reading. 5, resolution appropriating funds from the Batten Foundation to the Department of Human Services, $40,000, second reading. 6, an ordinance amending Section 30-53 of the Charlottesville City Code to increase the assessed value threshold at or below which qualifying vehicles will receive 100% personal property tax relief from $1,000 to $1,500, second reading. 7, resolution establishing the 2024 tax year personal property tax relief percentage, one reading. 8, resolution for revenue sharing program appropriation of $394,256 and a transfer of $394,256 for multimodal improvements, FY21. That's one of 2 readings. 9, resolution appropriating funding for the hydraulic road shared use path study, $40,000, one of 2 readings. 10, resolution appropriating Dogwood Memorial Foundation state grant pass-through funding, $600,000, one of 2 readings.
Thank you. Is there a motion to adopt the consent agenda?
But before we do that, I actually do have a question on one of them.
Okay?
On, I think it's number 2, the Rugby Ave bicycle and pedestrian trail. It says in the, hang on, a lot of scrolling. It says in the agenda item where there's more details that there's a VDOT grant, but then it also has Fund 426 transfer to. Can you explain Fund 426 a little bit, and where's this money coming from? I mean, I like the project. I just want to be clear on the VDOT grant versus Fund 426. Is it just a pass-through, or what
Fund
is that?
426 is capital projects. So all the VDOT projects are actually in the capital projects fund. They're offset by state, local, federal funds.
So this is kind of like a pass-through?
Correct.
Okay, great, thanks. That's all.
Great. Would you like to make a motion to approve the consent agenda?
Motion to approve.
All right. May I have a second?
Second.
Everyone cast your votes.
Motion passes 4-0.
Motion passes 4-0. Thank you. All right, Mr. Sanders, is there a report from the city manager's office?
Yes, sir.
There we go. So I'm giving you my third quarter work plan update. I actually delayed it from the first meeting because you have more visitors, and I thought it would be best to get out of their way and allow them to speak to you as quickly as possible. So I'm going to walk through just a few highlights for this third quarter. First and foremost for me, I'm very excited about the idea that the gallery is full. My team is set with the addition of Mr. Freeze as our DCM of operations. He is no stranger to all of you and most of you, but James has been already hitting the ground running. In addition, I made an adjustment to the breakdown of the portfolio, moving the community solutions team over to James's portfolio, since he works with them a lot already, and thought that that would be a good transition. Some key personnel matters. I'm sorry?
Could you go back?
Yep. There's a lot there. That is your city at work.
Yeah, thank you.
Can you remind us again how many staff we have?
A little over 1,000 positions funded.
Thank you.
I didn't want to say the wrong number because we've been making adjustments. Some key personnel matters. As I mentioned, we've hired James. We've also brought on an assistant director of transit facilities and maintenance and a marketing coordinator in transit, and then some other positions that we're looking to fill. Those are the higher level positions that are very critical to a lot of the conversations. Some of the things that you heard about earlier in the transportation planning update, as well as some of the ongoing challenges that we face in getting things moving in the way that we know that our community is expecting us to turn around. Just wanted to touch on prioritizing human resource management. That's one of our big projects right now. Mary Ann Hardy and her team have been working very hard to do what I've considered and what I've called modernizing human resource management for the city of Charlottesville. One of the key projects has been a job description project to ensure that every employee will be able to look at a job description for their role and therefore understand what their jobs are. One thing that I added as a priority to the lead team upon taking the job officially in August was that performance evaluations would be an expectation of mine for all employees from here on out every single year. We have not necessarily hit that mark. Some departments have been very good at being able to continue to do that in the various stages of transition that we have found ourselves in. But I value this as one of those things that we must do, provide everyone an opportunity to know where they stand as an employee. So we're right now working towards bringing that to reality with all employees, being able to know that by the end of this fiscal year that they will have been evaluated in their current role. We're preparing for collective bargaining. That won't stop. That'll be, there's a lot of work that's gone into it. There's still a lot of work left for us to do. We'll continue to make sure that the team is ready to handle how that changes operations with the additional units that'll be coming, but we'll be ready to roll out transit, police, and fire July 1, as you have permitted with the ordinance. And we're concluding class and comp reviews. That's our process for making sure that all employees are placed appropriately on the new pay scale and ensuring that we are competitive in how we are paying our team and being able to recruit the most talented that we can for the various positions that we have open. And then we're producing a new training module and rolling out some new supports for the workforce. You heard about this a little bit earlier in the transportation planning update, and I decided it was time for us to just celebrate a little bit more that we're getting sidewalks done. When I took this job and had my first meeting with the public back in July, I acknowledged that we care about sidewalks here, and we've fallen down on the job, and there's a lot that needs to be done. But I thought it was important to just highlight that we're making progress. Our Public Works team has been working hard, along with the NDS team as well, with Ben at the helm, been able to figure out how we can get more sidewalks done, and just sharing with you that that effort is fully underway. This is at Johnson Elementary area that has suffered for quite some time with some drainage issues. We're now prioritizing getting that done. And then Mr. Hicks was able to go out to the Fry Springs neighborhood and present the work that we're doing with Stribling in adding sidewalks there. So there's a community process for being able to speak on the proposed options, as well as the comment period for how we prioritize sidewalks. That'll be going through the end of this month. So I think it's important just for the public at large to know and understand that we are looking for input, and these opportunities to speak are on the website. And we do want to have that information, mainly because I'll say that as I've been in this seat as the city manager, my responsibility and my goal has been to be more matter-of-fact, straightforward, and honest about where we are. Haven't been afraid to say that we've fallen down on the job wherever we have, and I've always been able to say that we're going to get better. And that's what this is all about, being able to demonstrate that we're doing things differently, and we want to make sure that we can deliver what it is that you expect from us. We were able to celebrate the electric bus demonstration. Team from Gillig and Sunny Merriman, a transit bus and a school bus were on site at CAT April 3rd and 4th. It was a nice moment to be able to see what it would be like to have those vehicles a part of our fleet. We're doing that work and continuing to do the work to make sure that we can integrate that into our inventory. And once we are able to bring an electric bus online here, we will be the first in the Piedmont region. The Piedmont region is more of a sliver, I guess, following the mountain range on this side of the mountain. We'd be the first ones to be able to get that done. So we're excited about that opportunity to bring that forward, and we think we will be the first by the time we get the first bus. And then up next, I mean, we're in this fourth quarter now. You've already had your affordable housing update. Antoine did that at the last meeting. Transportation planning, you got that earlier this afternoon when Ben was able to speak to you. Misty is coming up next to share with you the co-responder model that we're rolling out. Stephen will be with you next month on the VDOT portfolio update. James is going to come and talk about Downtown Mall Action Plan, and Ashley's going to come and talk to you about social equity priorities. Just demonstrating for you all that we're moving. We're still doing things, and we're going to get these things done before this fiscal year is over. And then I decided to share with you and where we're going in the first quarter, because we're not stopping. So I just wanted to give you this quick update and just remind everyone that we are in a good place, but you know, there's always a lot more that needs to be done. There's a lot faster that we would like to get things done. But again, my priority is to remain truthful and be able to tell you when we can do it, and when we cannot, tell you why we can't do it, and when we can get around to doing it. So with that, I'm going to turn it over to Misty and let her walk you through Anchor, because we're excited about that new program.
And just a little housekeeping. Remy, if you're listening, oh, look at that. Brilliant. I just wanted to double check that our slides made it to where they needed to go. Good. Mm-hmm. You got it. Thank you very much for the assist. Good evening, Council. I'm Misty Graves, the Director of the Department of Human Services, and Sam asked me to give you an overview of Anchor and what we've sort of conceptualized to this date in our development of a co-responder model. In case you're curious, Anchor is an acronym and a symbol. It stands for Assisting with Navigation, Crisis Help, and Outreach Resources. But it's also intended to evoke what an anchor does for a ship in a stormy sea, that it's a stabilizing force for someone to be stabilized, to receive what they need to be able to sort of transition onto calmer water. So that's where the name is, a symbol and an acronym. And you can go to the next slide. I don't think I have the clicker.
It's over here. It's only one, I'm sorry.
All right, just to give you some background and sort of define a little bit more clearly what a co-responder model is. So the International Co-Responder Association defines a co-response model at its core as the belief that partnering first responders with behavioral health professionals is an effective way to respond to behavioral health crises and other situations involving unmet behavioral health issues. The first co-responder teams were established in the 1970s and have continued to evolve to include fire and EMS. As first responders, hybrid teams, and peers, teams not only receive crisis calls, but now also perform follow-up services, case management, outreach to unhoused populations, and resource navigation work. So that sort of identifies what co-response looks like. For several months, about a year now, we've sort of been exploring some potential models to roll out here in Charlottesville. And we had consulted with some of our external partners, such as Region 10, CARS, Partners for Mental Health, Albemarle County Hearts team, and the Emergency Communications Center. We also took a look at the Hearts model more in depth, since they've been doing this work since July 1 of this year. So we have met with them to sort of hear more about lessons learned and ideas that they have. They've been very helpful in sharing some of their lessons learned with this team. We've also looked at some other localities, including Durham, and the Cahoots model that's been in existence since the late 80s in Eugene, Oregon. We also reviewed a previous work group that the city had that was led by the former councilwoman Sina McGill. So we reviewed those recommendations as we started to build out what the infrastructure might look like here in the city. And I just want to recognize some of our internal planning team superstars. We have Sue Moffitt, who's the director of the Department of Social Services. Jenny Jones, who couldn't be here, is the deputy director for that department. We have Joe Phillips, deputy fire chief, Captain Larry Jones of the CPD, and unfortunately Officer Tammy Shiflett was unable to be here. Myself and Ashley Marshall, deputy city manager of social equity. Overall purpose and goals, our purpose statement is the anchor team seeks to respond to behavioral health needs of individuals, including opioid overdoses within the city limits, through providing trauma-informed and culturally responsive supports. Some initial goals that we have thought through is connect residents to stabilizing providers for long-term supports and prevention services, engage in harm reduction efforts, and prepare the community to implement the Marcus Alert legislation. We also partnered with the ECC to give us some data about what Albemarle and Charlottesville are seeing as far as behavioral health needs, and they identified that in Charlottesville there were 619 behavioral health or substance use calls in the city of Charlottesville. That's just to give you a scope of what the need is here locally. So here's our co-responder team. So we will have 2 fire department employees that are CIT trained and medics. We'll have 2 CIT trained police officers. We will have 1 QMHP that is employed by Partners for Mental Health. We also have 1 peer support specialist employed by Partners for Mental Health. And I will serve as sort of the coordinator, support, admin support, and serve as the liaison between the anchor team and the city manager's office. Another point is that we have decided our hours of operations will be Monday through Friday, 8 a.m. to 6 p.m. And that was pulled from ECC data where we looked at the peak times of calls, and this is really where it was identified the highest level of need. So there are some major activities that we have identified. So the first is collect and analyze data to respond to community needs. What that will look like is that we will work with CPD and the fire department to pull records of maybe where some of the calls are that needed follow-up and the after hours where we were not able to serve. Engage in follow-up calls. So for example, if something transpired after the working hours or if someone had an opioid overdose, and we would want to send the anchor team to be able to provide some emotional support, some guidance on resources to prevent any other needs that might happen in the future or crises. Perform welfare checks. We'll identify some initial partners that could ask Anchor to do some welfare checks if there is a person of concern, and be able to collaborate with first responders to intervene. So when the call comes into the 911 call center, they will dispatch a first responder. That first responder, while they're on scene, will assess the scene to see if it's a better fit for the anchor, and then they'll dispatch Anchor from there. And we will go and do some of these on-site activities, which include de-escalation and assessing those individuals experiencing mental health crisis. We may be able to intervene on-site, and sometimes we may have to offer transport to a crisis assessment center or to the emergency room. And then, like I said, the follow-up response, we would want to make sure that we're partnering with individuals and their families who have been impacted by the individual experiencing crisis to offer some support, some connection to longer-term resources, because we will not be able to provide those case management long-term services, but we will partner with other service providers locally to be able to provide those long-term needs if that's needed for the individual and their family. And then we have a van. The fire department has acquired a Ford Transit van? A Ford Transit van that we can be able to go on site to respond to folks. If it's out in the community, it may be helpful to offer privacy for folks experiencing a mental health emergency. They may be able to work with the Anchor team inside that van for confidentiality and privacy. We would be able to have some equipment and resources like Narcan and things like that on the van. So those are some of the pieces that we've sort of figured out with the infrastructure. I, again, just want to acknowledge our Partners for Mental Health and the internal planning team for being able to come together and get us to this point, and our goal is to launch July 1. So we're working towards that goal. We'll be doing some, and continue to engage with the community to make them aware that this is anticipated to be rolled out in July 1 and be able to hear feedback. Any questions?
Yeah, thank you so much. That was an excellent presentation. Any questions?
I have a couple questions. My first question is, Albemarle County is also doing something similar, and I'm wondering how what you're doing or proposing to do differs from or works with or is compatible with what Albemarle is doing.
Yeah, so actually we have Sue Hess here, who's a member of the Hearts team, and Virginia's also here, who also supports Hearts. And they've provided some consultation to us about, like I said, lessons learned. So one of the main differences is that, one, we will have more staff that's funded in the FY25 budget. So there'll be, instead of just one fire department employee and one police department employee, and the Partners for Mental Health and the coordinator that's in the Human Services Department, we will have a six-member team that will be able to be more flexible with how often we're able to respond. We're including a peer support specialist, and I know that's something that the Hearts team actually thought would be of added value. So when we made a proposal to the city manager for a budget for that, we asked to include funding for a peer support specialist, and that's when we outreached with Partners for Mental Health, and they said that they would be able to recruit for that position. So we'll have a QMHP and a peer support specialist to add to the team. So it'll be a 6-person team.
So QMHP.
Qualified mental health professional.
And what level of training or experience will that person have?
That is a certification that you, like a qualification that you get from the state. And I don't recall off the top of my head how many hours of service in the field.
Is it an LCSW? Is it
It can be, they would qualify, yes. But we're not going to require a licensed professional. We would like it to be a QMHP that can be able to respond to those.
So the QMHP is a designation unto itself already?
Yes.
That's not internal, it's
It
from
is
the
a state qualifying credential that I can provide you with requirements for that, so you know what level of clinician it is.
No questions, but I think this is definitely a milestone event for the city, because I can just remember this being talked about in 2020 and coming up again and again in community work sessions, community task force. So I think this is just something really worth celebrating, all the hard work of staff and the partners to finally reach, again, a really milestone change for the city in our approach. So thank you all, and as you mentioned her, as well as just shout out former Vice Mayor Sina McGill, who I know was a champion for this on council and had also worked in this space, before her time on council. So I want to recognize her as well.
I just have a quick question. Forgive me if you kind of went over this already in talking about the background. So you said it's going to start July 1. Have there been like small little samples done so far, or are we just starting kind of with the pilot phase on July 1?
Pilot phase on July 1.
Okay, thanks. I wasn't sure if that was like, okay, full on, or if we done a little bit before. Okay.
Yes, I think just like the county, Kaki, who oversees the Hearts team, has said it's iterative. It's a word she really likes to use. And so it just means that you learn through experiences. And like I said, we've had great partners with Sue and others on the team being able to consult with us. And then we're going to be hopefully going to some national conferences on co-responder next year, and we'll be able to maybe visit Durham and do a site visit and do some training and learning from those other localities who are doing the work. So our plan is to continue to coordinate with the Hearts team and even be able to get to a place where we're having some monthly staffing meetings so that we can be able to, through an equitable lens, since those crises are going to happen over the boundaries, we want to be able that we have an equitable response no matter where you are if you're in this community.
Excellent, thank you.
Great, thank you so much.
So if I could just want to point out that we do have the Marcus Alert implementation mandate that we are working our way towards 2028 when that must be done. And I think it's the great first step in that direction. And while this is not full implementation, it's just a component of, it's important for us to continue to start chipping away at what that future responsibility is going to hold for us.
Yeah.
Deputy City Marshal, were you going to say something?
I was going to try and answer some of the questions, but you all just kept moving. But for you, Councilmember Snook, a qualified mental health professional most often has a human services degree, and there is a requirement of some clinical experience. As Misty rightly pointed out, that person can have other bona fides, but one of the benefits of a qualified mental health professional is that you can also often have people who have lived experience. It does not require being a licensed nurse, for example, but that may be something that the individual it also carries with them if they so choose. And I think one other question was about some of the potential differences between Hearts and Anchor. While we're working very much to make it similar so that no matter where an individual has a mental health crisis, they can receive that access, that accessible care. One of the things, thanks to the work that you all have done and the city manager has done, is by putting it in the general fund budget, that will allow our team to have latitude to assist anyone in any mental health crisis that can include substance use disorder. But I do know that the county has utilized some of their opioid fund dollars, which means you have to report on how much work you're doing with specifically opioid use disorder and that abatement. But we know that there are other substances that individuals may be using to satisfy, so there would be no limitations in that area. And we also know that individuals may not be using a substance at all, but may very well be having a mental health crisis. And I did also want to very much thank our deputy chief and our captain from our fire and police departments respectively, because we are also utilizing their data and expertise. Both our firefighters often and our police officers here in our community are crisis intervention team trained. Which means that when they do happen to need to go and respond to a mental health crisis, both departments place a high priority on that training on how to work with someone that is having crisis. That also means that they're doing a really great job in collecting data of when those crises occur, what they may look like, and helping us to plan in our community what those things might entail and how we may start to prepare to be of best service to those who are having those mental health crises, as well as their families. And very much want to thank our friends at Partners for Mental Health for reminding us that this team can go and provide assistance to a family. For example, perhaps after someone who has suicidal ideation maybe has an attempt, to be able to provide that counsel, or perhaps if someone has an overdose at home, to be able to provide Narcan and assistance. So I just wanted to share a little bit of proud moment. I'm very thankful to be able to work alongside members of our team who've put so much time and effort in it, from Sue Moffitt discussing how maybe adult protective services could work, Misty Graves from her experience working with youth. It's all been really great, and I think it's coming together in a really wonderful program that while we're piloting it, I think you all will be very proud of it.
Thank you for that. I really appreciate you sharing all that. It was very helpful. And again, thank you for all that y'all have done, and this is really important work. So thank you.
Could I add one little thing? The easy way for us to have addressed this problem, frankly, would be to not address it until we were required to do so by the state, which is a couple of years down the road. Mm-hmm. And the fact that we were willing to say, we're not going to wait for the state, we're not going to wait for the state funding, by the way, we're going to go ahead and get started with it on our own, with our own sort of homegrown program, is important.
Yeah.
And worth note.
Yeah. Okay, I think we can move on to the next item on our agenda, the action items. Item number 11 is the FY 2025 budget ordinance and annual appropriation and tax rate tax levy ordinance, the second reading. We have Ms. Chrissy Hamill and Mr. Sam Sanders who will present.
Chris is going to take it away.
We made it to the finish line. We've had a series of work sessions, a series of public hearings. Tonight is our final public hearing and adoption of the budget. Before you is a copy of the tax levy ordinance, which discusses the new rates that are included in the budget, as well as the budget ordinance itself. And so with that, I will leave it to you and the public hearing, and happy to answer any questions.
For the benefit of the public, can you explain the difference between the adopted budget and the general fund numbers?
So The general fund budget is basically the budget where we spend all of our time. It is the operating budget of the city. It is where the general fund is the repository for all of the tax revenues. And so most of our work sessions are centered around the general fund budget. However, there are about, pulling this off the top of my head, I believe about 36 separate funds within the city organization, which are basically like 36 separate businesses, which make up the total city budget. And all those budgets run from July 1 to June 30th. And those total out to just over a little over $607 million. But the general fund is, we're just at the whatever it is now. Yeah.
Thank you.
Does that answer your question?
Yes.
Any other clarifying questions? Okay, I'm going to open this public hearing. Speakers will have up to 3 minutes to speak. Please come to the lectern and state your name and where you live and ask your question or make your statement. Okay. Going once, going twice, going 3 times. We will close the public hearing. Are there any questions from council for staff?
Is this for item A or B or both? 2 separate ordinances, 1 tax levy?
The public hearing is for both. And then we have to treat each ordinance separately.
Right.
Okay. Well, this is just a clarifying question for the overall budget. So we've reached consensus about adding 8 bus drivers. Obviously, we heard about 11. I just want clarity on how much of the additional revenue from the revised revenue estimates went to those 8 drivers, just to get a sense of, what realistically it takes to get from 8 to 11. I don't know if that makes sense.
It does. The amount that is going to transit is $601,681. That is basically the difference. If you recall last week in our work session, the chart where we did the math, that takes into account the new revenue plus the change in the personal property, the 20 cents. And so that amount is what will be going to transit. We actually, instead of designating, we put it as a service capacity increase for transit, reserved for drivers, but we put it in that space so that we, instead of just loading FTEs, that it's a more thoughtful and planned out process. But the plan is to use those for drivers.
And so it works out to basically, for $600,000 for 8 drivers, that's about $75,000 per additional driver.
I think that's what it was. I'm sorry, I
That's
forgot
right.
the number.
76, I
Yes.
think.
And so that was all of the additional revenues were directed
Correct.
towards this?
Correct.
So to get there would equate to finding about $200,000 from somewhere else in the budget.
230.
Yeah.
To get to the total 11.
To get to 11.
Correct. And so I know we're not in a situation to amend the budget tonight, and there's no easy place to find that money. I wonder if in a similar position, a year from now, if we find we had more revenue than we estimated, if we can't do it as a policy, but, are we committed to kind of earmarking that commitment for when revenue comes available? That is one of our top priorities, for it to fill that gap to get to 11 drivers.
Is that, I guess, a question for
Counselors,
council?
yeah.
Is that something that we could, you're offering it to, when we review everything next year, but is that something that, like, mid-year, when we get our mid-year revenues, we could take a look
So-
then, or does that count as like one time?
That would be one time.
Okay. So we would have to wait all the way till next year.
Yeah, and I would be interested to see how the process evolves. I think there's a lot that's going to happen in transit in the next year, and you've got a lot going on in transit, and so I think if we get 8 drivers spun up and ready and operational, I would be very, very happy with that. So.
Yeah,
11
and
would
I-
obviously be better. I just have my doubts about in terms of the, just getting the work done if,
And-
8.
And that's, I hear you, that's fair. I just want us to, for ourselves as counselors, kind of earmark it and keep this as a top priority, because
For like
11,
for like the surplus, you're saying, if there is a surplus?
well,
The
not
surplus
whatever
wouldn't
one-time.
go to wouldn't go to adding more positions.
But we've just got to get to 11 just to meet pre-pandemic service. We said coming into this budget cycle, transit was top, it ended up falling out, so we didn't get there. I know we were at 0 additional, now we're at 8. I don't want to undermine that is a significant positive change. Going from 0 to 8 is big, but
You're talking about for the budget for next year, keeping this top of mind?
correct, and to go probably even beyond it for some of these transit plans, because I
Yeah.
feel like we're just talking the talk on transit, but we're not backing it up with the bare minimum for us as counselors.
So I will offer, because I believe I'm hearing direction now, which is great. I love hearing that. What I'm hearing you say is that you want me to not separate myself from the priority of transportation in preparing for next year's budget. Got it. As I mentioned to you at the start of this budget cycle, that was my intention from the very beginning, was that transportation was going to be one of the top 3. I think what I'm also recognizing, and because of the various conversations that we've had with the larger public, we have to continue to make investments in transportation. So I can assure you that it will not leave my radar, that will be a part of the packaging that we put together for the FY26 budget. And, I'm sorry, and there is, part of what Christy wasn't wanting to say, because she was probably waiting for me to say it, we are going to internally look at, are there some other things that we might be able to do that could benefit CAT in that ability for us to add additional drivers? That's one of the things that we still have as an option. We have some positions that are 30 hours that have not been filled. Part of the strategy could be that we might be able to pull some of these dollars to go with that and make that a full-time position. And then you actually would be able to recruit someone for it, because we have not been able to fill these 30-hour positions. So there's a chance that I might actually be able to come back to you and demonstrate for you that while we didn't add 11 drivers, we had the impact of adding 11 drivers. And that's really what I would like to make sure that Mr. Freeze is working on with Garland.
Yeah, and yeah, I mean, and whatever it takes to get that ultimate impact.
Sure.
And just for me, transit is still there as a top 3 priority, because we've made a lot of promises that are contingent on the transit system working that we haven't followed through on yet.
Absolutely.
Can I ask one other question? I have a vague recollection when we last talked about things 11 days ago, that there was a possibility that there might be yet some further revisions on revenue numbers. Were there any?
There were none other than the $1.5 million that we had from
Okay.
last week.
Okay. No new news.
No new news, sorry.
Any other questions?
No further questions.
All right. So 11A is the ordinance establishing the annual tax levy for tax year 2024. This is the second reading. Is there a motion regarding the annual tax levy?
Let's see, what page is that on?
Page 51 in the packet.
Okay.
The ordinance is on page 53.
Okay. Well, I'm happy to make the motion. Happy is probably the wrong way to put it. I will make the motion for the tax levies as set forth in the ordinance that's set out on page 53. That would have a 98-cent tax, 98 cents on every $100 assessed valuation of real property, $4.40 every $100 of the various kinds of personal property, public service corporation property, 98 cents. Let's see, machinery and tools, $4.40, energy efficient buildings, 48 cents. All is set forth on page 53.
I have a motion. Could I have a second?
I'll second.
Thank you. Any further discussion?
I'll just say counselors have heard this, but I'll say it for the community. There's no need for us to relitigate it, but I'll just say it again because it's what I think. I do think going into this budget, it was very likely we needed revenue increases. I'm fine with that. I understand that. I do think there's some agreements that at least maybe it couldn't happen this year. Over the years, 1.8 million going to the tourism board when that number was 700,000 a few years ago. Would it be better for the tourism industry to not increase a meals tax than all that money? Maybe. But regardless, we probably still need to increase taxes. But I think we've pulled the wrong levers looking at the regressive taxes the most. Meals tax is very regressive. Lower income families spend more of their income as a percentage on going out. Whatever we think of the statistic, lower income families eat out more than wealthier families, not fine dining, but just eating out. Likewise, the personal property tax, I'm concerned, is regressive and was also done in a way that didn't give the community a significant amount of time to give their feedback. So I say all that with the concern not only for this year, but going into next year, if we're looking at revenue increases again, I think it's going to be a mistake for us to rely on these more regressive revenue sources. I think the proper way we should have done it is leaning on the real estate tax and expanding that relief program for anybody that impacts. And I'll just end with, I think, if someone has a house worth $500,000 and that tax increased by a cent, their annual tax bill will go up $50. The change we made to personal property tax, which was not the original larger one, their annual tax bill for a car worth $10,000 will go up $20. That $500,000 house is, and I don't want to minimize the financial problems that can come with that, but it's also an asset in wealth. Which of those is more fair? In my mind, it's clear, and I don't think we've pulled the right levers, but.
Okay, thank you. So we have a motion and a second. Any further discussion?
I just want to note that, Michael, I think the only thing that has been suggested was an additional penny on the real estate rate, which if we were to look at that to offset against the personal property increase, it's almost an even trade. That doesn't touch the meals tax. For better or for worse, most of the additional money we are raising through these tax increases, frankly, most of it to go to both schools and staff salaries, most of that's going to be coming from the meals tax. And nobody on this council, as far as I know, has suggested an alternative that would make up for the roughly, I don't know, it's a $3 million or something that we're expecting to get out of meals tax revenues. So I completely understand the philosophical point about regressive taxes and so on, but I haven't heard a suggestion of a different formulation.
Well, I'll say from the beginning of this process, I favored a larger real estate tax increase than even the 3 cent advertised, but there was not consensus to advertise more than 3 cents. So that was our constraint.
Okay. I think at one point you had mentioned 4 cents. That still doesn't get us to the meals tax. So, anyway.
I'm sorry, can you remind me, the meals tax rate, we've already approved, right? That was done in an earlier meeting? Mm-hmm. Okay.
And sorry, just for any industry representatives who are concerned about the meals tax, which is understandable, I think it's important to join with us in a conversation with UVA. If they paid even 50% of their tax liability, none of this would be necessary to consider. Restaurants have pool. I think it's important to be part of that conversation.
I agree with that. Okay, so we've had a chance to chat. Can people please cast their vote? Okay, so it's 3-1. Three in favor. There's nothing strange in that we're down one member in terms of the number of, as long as we've got a quorum and as long as we pass. Okay, all right, majority rules. Okay, so now we're on to 11B, an ordinance approving a budget and annual appropriation of funding for the city of Charlottesville for the fiscal year ending June 30th. Second reading. Is there a motion regarding the FY25 city budget and annual appropriation? That is on page
57.
57 of the packet,
And many pages thereafter.
and many pages thereafter.
I would move the approval of the budget as set out.
Thank you. Is there a second?
Second.
Okay, any further discussion?
One thing I have to make a note of, part of, buried in here someplace is a cost of living increase for retirees. And my wife is a retiree after serving as the city attorney's office for 8 years, and she gets a pension of about $300 a month. And this will raise her pension by about $5 to $6 a month. That does not disqualify me from voting, but I am required to state it for the record. I'm stating it for the record.
Thank you. So we have a motion and a second. Is there any other discussion? Okay, so if folks would please cast their vote. Okay, the motion carries 4-0. We have a budget. Thank you.
Thank you very much.
And thanks for all of the team that works on this every year. This will be my third budget, and it really is a remarkable process that y'all go through. And
Now the real work begins.
yeah, well, that's true, but there was a lot of work up till now.
Yes.
And I appreciate
Getting
your
ready to start on the next one.
appreciate your flexibility. You had some, I think, some creative ideas kind of at, towards the last minute that you all were willing to countenance and work with us on. And I personally do feel like this budget gets us moving along with our priorities. So thank you all.
Thank you.
Okay, so the next item, item 12, is allocating stormwater management for small infill sites funding in the amount of $21,000. Mr. James Freeze, our new deputy city manager, will be giving the presentation.
Yes, thank you. Good evening, Vice Mayor Pinkston, members of council. Again, my name is James Freese, Deputy City Manager for Operations, but tonight I'm coming to you wearing my old NDS Director hat to talk about stormwater management on small-scale infill sites. So as you all know, one of our objectives with the comprehensive plan and the zoning ordinance was to encourage small-scale development on small infill sites. 3 to 8 units on regular-sized residential lots. But one of the challenges we've already started to see with some of the applications we have is that the cost of preparing engineering plans and the permitting process for these projects under our stormwater management ordinance is a burden on those projects and challenges their ability to come through the review process. So what we're proposing is to take $21,000 out of the small area plan fund in the CIP to work with a engineering consultant to come up with a essentially kind of pre-approved stormwater solution. The idea would be that someone would be able to come in and take our detailed plans and a calculation run by us, show how they're going to put that on a given lot, and then they would be able to go to approval. So what we're saving them is the cost of doing their own independent engineering study of their site. So at that point, I guess I ask if there's any questions.
Thank you. Any questions for Mr. Freeze?
I'm just curious, what sorts of things is this really going to work with?
I think what the main idea we're looking towards is idea of a kind of a raised bed bioretention type structure that where particularly roof runoff would be run into that structure, and the size of it would be determined by the amount of impervious area on the lot. So theoretically, one would type in their impervious area, it would spit out the size of it, and then they would refer to our detail and build and kind of build that appropriately scaled structure.
Okay.
So like a retention pond?
Not like a pond, but a
Cistern?
No, like the
swale.
Swale.
Yeah, like a swale. Yeah, a planted area is the basic idea we're working from. But I mean, ideally, we'll come up with more than one solution. That was the one that we talked about in concept as one of the options. But the main idea is to come up with a solution that's kind of pre-identified and then can be scaled based on the level of imperviousness on a given site.
I know that there's other cities that use standard plans for architecture. Are there other examples of this sort of thing from other cities?
There's not of exactly what we're talking about that I'm aware of. Hopefully there are some out there that we can borrow from, but I can speak from prior experience in a different community where we were subject to the Chesapeake Bay Act. We had a standard solution for meeting some of the buffer and stormwater requirements there that we had kind of standardized out. This is going to be more sophisticated than what we were using because it's going to try and actually work a calculation and do it.
Okay.
Okay, we're at a point now where if someone would offer a motion for the resolution, I'd be quite grateful. So on page 74 of the packet.
I'll move the resolution on page 74 to allocate $21,000 from the small area plan project account.
Thank you. Is there a second?
Second.
Okay. Any further discussion? Please cast your vote. Carries 4-0. All right. Thank you, sir.
Thank you very much.
All right, take care. Right, so that takes us pretty close to the end of the meeting here. So the last item is a written report from Ravenna authorities, the quarterly report. It's in the packet. I know that there's still interest in having them come and present at some point on the Ravenna station, the Ravenna pumping situation. I did look in the report, and there was some good information there. We have a Ravenna meeting next week, I think. Mm-hmm. And I'll remind Bill that we want him to come at some point and give us an update. Any other questions about, and we're going to be hearing about water rates and so on in the June, okay.
Okay.
Anything else? Cool, great. So we're now to community matters, our second second option for community matters. This is the final speaking opportunity for members of the public. Individuals in council may raise your hand if you want to speak. Please come on up. You'll be given 3 minutes. Please state your name and your address, please, or street.
Rebecca Quinn, 104 4th Street here in the city.
Okay.
Went upside down. So I've been out of touch with what's been going on with the city for some time now. When I saw number 12 on your agenda, stormwater, even though it's from a different fund source, it made me decide it was time to come and ask a question. Isn't the Water Resources Protection Program, advisory committee still on the books? It was established by ordinance or resolution, I'm not real sure. There were bylaws. The webpage still shows the 2019-2020 membership. I was a member of the committee at that time. And then, of course, we all know what happens in the next few years. A lot of things kind of went by the wayside. But the committee was established by council because of citizen concerns about the stormwater fee when that was established. Y'all weren't on the council at the time, but it was pretty controversial. But my question is, has the advisory committee just been allowed to go dormant? Was there a decision? I didn't look back in the last several years of agendas to determine that. Maybe there's a good reason, but I'd like to know for sure, was it council action or is it just inaction? And especially if, it is run as a utility, so there are fees. There was a lot of concern about the rate, how the money was going to be used, when, what might happen if council increased that rate. So that should be part of the utility rate discussion later on. I'd also like to echo comments from the first public session about incentives to move away from gas. I bundled a couple of Christmases and birthdays for my sister and bought her an induction stove. She was a little hesitant. She had thought she would have to give up the set of pots and pans she got when she was married many years ago. She didn't, but I also bought her new pots and pans. There's a part of that I think some people are missing, especially if you do things like cook a lot on top, cook pasta, soups, canning. During the summer, the cooktop produces so little wasted heat. You don't have to air condition that hot air. If we can have more incentives, you know, we have incentives for low-flow toilets. Let's get some incentives, not just the tax incentive, but a city-run incentive for more change-out. I own 2 apartment units. With LEAP help, I replaced a gas furnace in one of them with an electric. On my own, I did the same and replaced gas water heaters, and you know what happened with the electric bills. Thanks.
Thank you so much. If I could ask the city manager to make that a point of inquiry about that committee.
Yeah, what I can offer at this moment is that there was a transition in the management of the stormwater utility. It is now back in the utilities department. So there is an effort to revive a few things in regards to its management. So we will make sure that we follow up on that.
Thank you.
And the information I have is that the city appoints 1 member to that board.
Okay.
That it's not a local, it's not a city
Okay.
board.
It's a city-developed committee. The council appoints all the members.
I'm looking at the website. Is it the Water Resources Protection Program Advisory Committee?
Yes.
Okay. I have a dim recollection at some point of having, one of the members, according to this, is Patrick Healy. I know that I have at some point voted to appoint him to something, and maybe it was that body.
That is.
Yeah.
Okay. Thank you.
It has been dormant, that much I know.
Okay, who's next? Who would like to speak next? Raise your hand. Yes, sir?
Downing Smith again. Well, I talked about taxes at first, but Mr. Payne said we're going to talk about taxes later, and I'm basically the 20-cent real property tax. Apparently, y'all blew that one past me with that A and B stuff, and I guess it was in there somewhere. But I have questions. This thing sort of came out of left field. If it wasn't for Sean Tubbs, I would have never known about it. I don't understand it. How much money is it going to generate, that extra 20 cents? What's it going to be used for? Was it part of the budget revenue that y'all had before? And is the reason really that you want to make people more aware of not using their car? Because if it is, then that's a really bad reason to pass it. That it's sort of a useless, meaningless gesture to try and get people out of their cars. I drive an 8-year-old Subaru. That 20 cents on my 8-year-old Subaru isn't going to make me change what I do. I don't take the buses because they don't work very well for me. I walk when I can. I don't ride a bicycle because if I want to go to a grocery store, I can't carry 3 or 4 bags of groceries on my bicycle. And besides, it's suicidal to get to any major grocery store because you have to go to a major thoroughway. Now, if you'd said that 20 cents was to get your extra 3 bus drivers that you want, well, that would have made sense. But I just don't understand the whole thing, where it came from, why, if I hadn't read Sean Tubbs' column, which everybody should subscribe to, I wouldn't have known about it until a day or 2 ago. So I don't know even why I'm standing up here talking now, because it's a done deal, and it doesn't really, I don't really need to understand what happened, but somehow I missed the boat on this whole thing.
Okay, thank you. Who else would like to speak? Yes, please.
Hello, I wanted to take just a moment to introduce myself. I'm sorry I had to step out earlier. Lightning and soccer don't really mix very well. My name is Libby Jones. I'm the new executive director at the SPCA, and I just wanted to come here and introduce myself. I'm sure you have heard my name, and I'm sure you know about our organization. So I just wanted to say hello. Thank you.
we have a proclamation for you that we read earlier.
I'm so grateful. Stray day awareness is so important to us. Obviously, it's a critical service that we provide that's mandated by the state. We want to make sure that every stray animal reunites with its owner, and when it can't, it finds a good home for the rest of its natural life. So thank you.
Thank you. Who else would like to speak? Anyone else?
Before you adjourn, I have two items
Yes, sir.
that I missed in my report. The first is just for the public's benefit. I did sign an administrative order last week appointing Sands Anderson to serve as the interim city attorney. Represented tonight is Pamela O'Berry. You'll see her and maybe her counterpart, Andrew McRoberts, depending on how long we have them engaged in this capacity. But we had our first meeting today, and they'll begin to support the city attorney's office for as long as we need. And the second item was in reference to the National League of Cities is celebrating its 100th anniversary. They're doing a road show. They selected Charlottesville as one of those cities, and they're going to make a stop here in town on the 17th, Wednesday, and take a picture with us on the downtown mall. So it's a big deal that we got picked. So just wanted to share that and just say.
What time is it on Wednesday?
2 o'clock. But just in honor of a national organization that's doing amazing things, building community around this country, they chose to come here, so I like that.
Fantastic.
One point, Mr. Sanders, I know you had up on your screen there the chart of how much tax revenue
I was trying to
comes
figure
from
that
what.
out. Yeah, I didn't have it available.
As I recall, 1 penny on the personal property tax rate is $30,000.
Correct.
So the 20 cents that we're adding is the $600,000 that basically is funding the new bus drivers.
Correct.
And if